This is Talk to Keddy, sharing knowledge, liberating minds. Hello there. Thank you so much for joining us on yet another edition of your number one educative online broadcast, Talk to Keddy. Our topic of today is ulcer. In other words, we will be talking extensively about what ulcer is, the types, the causes, the symptoms, and the preventive measures to ulcer. To do justice to the topic of today is none other than one of our top leader. He is an honorary lecturer and the owner of Service Center 294 located in Lagos. Is none other than our amiable Mr. Adeyemi Kehinde, popularly known as Kenny Keddy. Thank you so much for coming to the show today.
Thank you for having me, Felix.
Yes, sir. Can you please introduce yourself to the audience?
My name is Adeyemi Kehinde, an honorary lecturer, a service center operator and owner of 294 at Ijaye, Lagos here.
All right, thank you so much for coming to the show today. We are delighted to have you in the show today. In case you are joining for the first time, this is Talk to Keddy, your number one educative online broadcast, brought to you from the stable of Keddy Healthcare Industries Nigeria Limited. We are the leading provider of quality healthcare products and equipment nationwide. You are welcome on board and do stay tuned. In today's edition, we'll be dissecting a cogent topic that has the capability, that has the capacity to affect anyone. It has so much power to affect or plague anyone, which is ulcer. According to experts, ulcer is rampant and common amidst men more than women. Okay, and ulcer itself, it's not life-threatening, but however, its complications, if not properly treated, can become severe and also can become a life-threatening situation. Okay, so understanding the types, understanding the causes, the symptoms, and the step-by-step preventive measures to ulcer is a very good way to managing this ailment. And as a Keddy consultant, I can bet it with you that the knowledge you acquire into this edition will furnish you with the right information in your practice. Okay, I believe we are all here today. So please don't forget, you can also be a part of this conversation in the comment section. You are not left out. Just log on to the comment section and type in your comment or your question. Let us talk. Let's rub minds together and let us learn. If you have any questions whatsoever, either on this topic or any other topic, feel free to drop your questions, and I can assure you that before the end of this broadcast, we will do justice to them all. So thank you and welcome on board. Yeah, so over to Sir Kenny Keddy. I believe you're ready now.
100%.
All right. I have discovered that many people, they don't understand the true meaning of ulcer. Sometimes they use it in a different way that is entirely different from what ulcer is. So, sir, based on your clinical experience, can you please tell us what exactly is ulcer and how prevalent is this very ailment in our world today?
Thank you so much, my producer. The word ulcer, generally, let me just go to the layman's approach on this aspect of it, is referred to as a sore.
Yes.
You understand?
Yes.
So an ulcer can be anywhere, being a sore.
Yes.
You understand?
Yes, sir.
But the one we are talking about today is the one inside.
Okay.
Are you with me?
Yes, sir.
Any type of an ulcer occur when the stomach acid damage the lining of the digestive tract.
Okay.
You understand?
Yes, sir.
And any sore that develop along the lining of esophagus, stomach,
yes,
and small intestine is referred to as ulcer.
Okay. All right. You've heard it. as according to what our Sir Kenny Kedi just said. So, sir, based on this your explanation, it is safe to believe that there are different types of ulcer and also different and with their symptoms.
Exactly.
All right.
Exactly.
So, can you please tell us the various type of ulcer that we have and their symptoms, all those ones that exist?
With the name, the way I enumerated it for the definition
Earlier, yes.
in the second part, I said it's the sore that develops along the lining of esophagus. That is one aspect of ulcer, esophagus ulcer.
Okay.
We call it GERD.
Yes. Yes.
You understand?
Yes, sir.
So this one is along the pie. The symptom for this one is that when you are swallowing, you find it difficult to swallow. But when you are drinking, it will be suiting you.
Okay. Only when you swallow.
When you swallow, you'll be finding it difficult to swallow. But when you are drinking something, it will be suiting you. Okay. It will be giving you chest pain. Are you with me?
Yes, sir.
Then the stomach ulcer, this other part of the ulcer, we call it peptic ulcer, is divided into two. We have stomach ulcer. The one is the inside the stomach. That's the largest and large intestinal part of it. Then the small intestinal piece, the one with the duodenum ulcer. That one happened at the inner tip or the upper part of the duodenum, the small intestine. Those ones, at times you may not even have any symptom for the stomach ulcer. You understand? Yes. But when it's getting severe, you understand, you'll be belching, feeling fullness, dizziness. Are you with me? Yes. Then at the same time, you have some pains during or after meal, mostly at night.
That's
when for the peptic
ulcer.
You understand?
Yes, sir.
That's the major challenges from that major symptom for that one.
Okay.
You understand?
Yes.
So that's the way you can easily detect it. And when you're having this, especially that of the stomach, when you're having it, you have pains around this side and you feel it.
Even at the back?
At the back.
Okay.
Go to anywhere in the world, you have already developed ulcer.
All right. Okay, so that's the type you have to talk about today, the peptic ulcer. All right. Okay. So, sir, with this now, having known that, okay, there are different types, but we are dwelling on the peptic ulcer. Yeah. Please, can you tell us the causes of, or the cause of peptic ulcer?
Thank you.
And the complications, so to say, if it is not properly managed or treated.
Yes. The major challenges about the peptic ulcer is that some people normally eat at the wrong time.
Oh.
They normally eat at the wrong time. This one will affect the digestive juice. Okay. It's more or less like somebody that is scraping the wall when it's not supposed to do so. If you scrape the wall during the rainy season, you may not feel it because the wall might have already been soaked. And when you are doing it, it will be easier. But when you do it during the dry season, what will happen?
You will see so many patches and so many, so even hard.
That is it. Yes. You understand? Like now. Then another challenge is that normally cause the problem of this particular peptic ulcer is when people are so much into what they call steroid drugs, anti-inflammatory disease, especially all these analgesic sort of things. I don't want to mention the name of any drug.
Okay.
Do you understand now? All those analgesics just to take out their pains here and there. If they are too addictive to it, my brother, the person will develop ulcer.
Wow.
You understand?
Yes, sir.
Then there are other parts of ulcer that is infectious, that being caused by H. pylori, Allitobacterial pylori. Do you understand? That one is infectious when that particular ulcer has already come up and is now infected. The bacteria has already entered it. You understand?
Yes.
That one is more higher than ordinary peptic ulcer. It's more higher than ordinary peptic ulcer. Those are the two major causes
of peptic ulcer. So, as we do know that prevention is better than cure.
Yes.
All right. So, what are the preventive ways? What are the preventive measures so that someone can avoid the occurrence of ulcer or probably even it developing at all? What are the preventive ways?
Number one, eat at the right time.
Eat at the right time.
Eat at the right time.
Okay.
If you are fasting, no problem. There's something called intermittent fasting to check your weight, to check your system, to rejuvenate your system. That's what is okay. But when you are not doing that, maybe because our fathers, our mothers, they did a lot of sacrifice for us to live. Where they're supposed to eat, they will stop it and make sure that their children eat. Before you know what is going on, they will develop ulcer. Eat at the right time. But by the time they want to be eating, they may be eating a wrong portion of food. Eating more than what they're supposed to eat at a particular time. Eating at the right time can solve a lot of challenges. Then 2, reduce alcohol. If you are smoking, if you are drinking, you are at a high risk of getting ulcer. Smoking, drinking, if you are the type that love this kind of spicy food, suya,
suya asu,
you understand? All those spicy food, they are very dangerous. Then at the same time, white bread.
Wow. People like us that doesn't like brown bread, that will like just white bread, make it should look fresh and just like it is just newly removed from the oven. Are you telling us that we are also at risk like that?
Yoruba used to say, but that baby is getting closer to the grave. You understand?
Yes, sir.
For those of our fear, what I mean is that Yoruba is a Yoruba adage that says, whatever the child wanted to eat will not cause a running stomach. But that child is moving closer to the grave. Are you with me?
Yes, sir.
That is an adage you use to defend yourself when you want to do something that is illegal.
Yes, yeah.
So, but for you to be healthy, when we are talking about health, you don't have any alternative. No matter how that thing is so sweet to you, or you are so much into it, you just have to stop it.
Yes.
When you get a particular stage in life, what you needed is changing of lifestyle. Because the way you are living your life when you are younger, you cannot use it. Like now, let me just go to digress a bit. When we are young, when we are playing football outside, maybe at the age of, let me say, 15, 16, 17, even 20s, and you mistakenly eat your leg with a stone, and the blood came out. You can actually put sand, continue playing ball. Try it now. You will see what will happen. So the immunity in the system has gone down, dropping completely.
So as we age,
the
immunity is dropping down.
The immunity is dropping down. Like generally now, according to the World Health Organization, it says every man must be supplementing what they are eating from the age of 35.
35.
Yes. You must be supplementing what you are eating with enough supplement to aid your living. But women from the age of 28.
Why is it that from age of 28 for women?
They lose a lot of things more than men.
Okay. Maybe through, a lot of
blood, calcium, a lot of blood, vitamin in the system goes out from the women more than men. You do menstruation?
No.
Not just for you to sweat, urinate. That's how you lose it. But then, when they cut their nail, when they plait their hair, when they sweat, when they cry, when they spit, when they urinate.
But men too, they spit, we are urinating.
You are dropping there, but you drop mostly through blood.
No.
What they drop through blood is too much more than what you can.
What to drop.
You understand?
Yes.
So that is that.
So at the age
smoking, at the age of 28, women need to be supplementing what they are.
And 35 for
35 for men.
Okay, sir.
So 35 for men. Smoking, drinking, eating a little spicy food. Then do you know those who have already gotten the ulcer now?
Yes.
They should run away from anything citrus. All those oranges.
Lime,
oranges. Yes. Just run away from them. You don't need them.
Wow. So what can they do? What can they do?
They need leafy greens, vegetables.
Leaf greens,
vegetables.
They
leafy green vegetables. Apple is good. Anything that is of fiber is good. Anything phosphorus that has phosphorus inside is good. All those berries, they are good. You understand?
Yes, I understand that. So I can see your questions coming in, so please keep dropping them in. Very soon we'll go over to the comment section and also attend to all our questions. So, my Oga,
Yeah.
based on what you just said about the preventive measures and those who are our lifestyle and cool, are there specific lifestyle changes or food precisely that I would like you to make mention of or just list out so that people who are in this can understand how to prevent or manage? Like you said earlier, there are some people that are living with ulcer and they don't know. Maybe like when you're talking earlier that some ulcer, like, is it peptic ulcer?
Yes.
Sometimes
You may not even know.
You will not even know that it is there.
Yes.
So if someone is in this category, what then can you prescribe? Are there a particular lifestyle changes or a particular type of food that such people or may use or start feeding on to prevent ulcer from developing or to manage the one that is currently existing?
Thank you, my brother. Like I already have said earlier, one of the most important things you needed to do is a lifestyle change when you get to a particular stage of age. A friend of mine, a colleague, is watching me the way when we are talking now. He approached me for a particular channel. I told him, do you normally do this? He said, I have to chop life now. Do you normally do this? Yes, why not? So now, from this period onward, live the life for those who want to chop life. Mm-hmm. For you, you want to chop healthiness. Yes. So if you want to continue chopping life, or you want to be healthy, you have to pick one out of the two. It's like you want to pick death or life. Exactly. It's left to you. And he made his decision. Since that time, he has considerably slowed down completely from there. Okay. So for those who are watching me who are suffering from the ulcer, yes, change your lifestyle. If you are the type that don't normally drink, stop it. I didn't say you should reduce it. Stop. Like stop. Total stop. Stop it. But someone that is addicted, how with the person, can the person, it's not really easy for such a person to just stop like that. It's not so easy. How can the person, what method can you just prescribe? When you come to my office, yes, for this kind of a thing, I don't hide to people. They say I'm somehow too harsh. I will ask you, do you know how much they are selling coffee? If you say no, I say okay, you are not going to be the one to buy it. Exactly. So that is why you don't need to know the price. Now, so, but you have to pick either the pain, yes, before the death. Are you with me? Yes, sir. Or you live healthy without the pain. Can I tell you the one of the most important that people normally run away from? To be on the bed and be useless. Exactly. Nobody wants to be useless in life. Nobody wants to be useless in life. You will see people that need your assistance, and you cannot do. Because you yourself need more assistance than them. Exactly. So when I give them that analogy, I will now ask them, do you want to live or you want to be addicted? They will decide on their own. So it is most important to tell people the truth. Don't try to hide it. Don't cover it. Tell them. Change your lifestyle. I didn't say you should reduce the alcohol. Stop it. Change your lifestyle. Stop drinking. Yes. Stop smoking. If you are addicted to bread, white bread, precisely. Even for now, run away from flour things. Run away from flour things. Sausage, like gala in the boss. Buy minerals. In the street of Lagos, that is our usual thing, especially on traffic. When we are on traffic, our next stop for survivor is gala. Let me share something with you. Yes, sir. The last time I came here, even before the last time I came here, I shared an idea with you. I was working on my weight. Yes. So, yes, I now discovered that one of those things that affected me most was that I love plantain chips like anything. Plantain chips. The moment I sighted them inside the traffic, I can order for 1,000 naira. I always like my mouth to continue working when I'm driving. You understand? At least to stay away. To stay out. I don't normally sleep. Okay. I love driving. Wow. You understand? Wow. I don't sleep while driving. So when I now sit and say that every idea, every method I was applying was not working, I have to look at what is that thing that I'm fond of that is affecting me. So I don't realize that it was this plantain chips. You cannot kill me. Because I realized they are fried. And
Exactly.
I'm trying to watch my weight, trying to shed because the tummy is coming up. You understand?
Yes.
And those ones are settling, they are sedimenting on my liver.
Exactly. And even giving the liver
More
job,
work.
more work to do.
I just have to stop the plantain chips.
Plantain chips. Okay.
Take me to the factory when they do plantain, I'm sure they look like this.
What if the one that they fry with palm oil?
Fry with olive oil. I'm not interested. Because I want to live longer.
Exactly.
I don't want to show up by my children will just wake up when they didn't see me. They will not say, this man, you are now making us to suffer. And they will be raining curses on me. I don't want that kind of a life.
Yes,
so I have to take care of myself for them to be happy. If you are watching me and you want to live longer, you want to run away from the ulcer, take care of your life. Change what you're supposed to change for you to enjoy it, one, and then for your family to enjoy you, two.
All right, sir. Is that all?
Then I've mentioned sausage.
Yes, sausage.
Run away from it. Frying things generally, you need to stop it.
Yes,
if you are addicted to citrus food,
yes,
stop it. That's all this vitamin C,
exactly.
oranges, everything like that. Papaya inclusive.
Okay. Wow.
They don't eat papaya. They don't eat cucumber. If you have ulcer,
pineapple. You know, some people ask us to go and take fruit salad. You cut fruit. All those,
if you see the one that can harm you there, you remove it.
Okay. Okay.
We are just telling you for your own sake, not for my own sake.
Of course.
I didn't have ulcer. You understand? Yes. Like I normally give people this kind of a challenge analogy. If a family, like let's say your father, your mother has diabetes.
Yeah.
What is that one telling you as a children? Be careful, because it can be hereditary.
Yes.
But if you can cut it off, you have saved your children.
The other lineage.
Am I communicating?
Exactly. Yes, sir. Yes, sir.
My father has ulcer. My immediate sister has ulcer. She was the one who took after
that.
My father. Do you understand?
Yes.
But when she now started correcting her ways, things subsided and she was able to regain her health.
Wow.
You understand? Yes. So what was that one telling us? You are the one coming behind.
So certainly
watch yourself.
Watch yourself. You can totally avoid it.
That is
all right. All right.
She knew what's supposed to be done, what's not supposed to be done.
But I guess that's because there was early diagnosis.
Yes.
She was able to know it on time that I am suffering from this. I need to attend to it immediately.
That is it.
All right.
I normally tell people, don't run away from medical checkup. You can just decide, say, what is really wrong with me? I don't feel like myself again. Go and run what we call general body test. Go and do it anywhere you feel like. Okay. They will ask you who sent you. Say, I want to know who and how my body is. Yes. They will run it for you. Do it. Yes. All thanks to Kedi Healthcare. I did my own beginning of this year because through our HMO. I always do it at least twice in a year. I'm due for another one now. Okay. I will do it in January. By August now, I'm supposed to go for another one.
At least to know the status of the body correctly.
That is it.
All right, sir. Thank you, sir. So, sir, before I run up and we go over to the comment section,
okay.
As a renowned KD consultant, and with some of you that has many years of TCM experience, what KD products will you recommend for anyone currently who is listening to us, hearing us? What KD products will you recommend to them in order to combat ulcer, to treat it and to avoid it? And how, and also the second part is that how effective, we are talking about your years of experience now, how effective has this KD products been in treating this ailment?
This one is a very simple pattern.
Yes, sir.
Because when you are talking about treatment of ulcer, it's one of those simple things you have done over the years. We have a lot of testimony about it.
Wow. Okay, sir.
A lot of testimony. Many testimony. Some will even use ordinary gastropod, they will be okay. Some will use the combination of gastropod and Cordyactive, and they will be okay. But when it's already infected, it's already H. pylori. It has been proven that it's H. pylori bacteria that causes it. You need to add reishi. So if it is infected, you need reishi, gastrifort, and Cordyactive.
Reishi, gastrifort,
and Cordyactive. But if it's not infected, just normal stomach ulcer, you need collaborative and gastric fort. Perfectly to handle it, and you will be a thing of God.
So how would the person use it?
It's generally 3 capsules of gastric fort in the morning, afternoon, and evening before meal, because gastric fort is an antacid.
Oh, yes.
You understand? Yes. It's before meal, like 30 minutes before meal, and collaborative 4 capsules morning and evening after meal. Gastric fort is before meal, 30 minutes. Collaborative is like 10 minutes after meal. 4 in the morning, 4 evening. But when you added reishi need to come before gastric fort. Is before meal.
Oh.
And now before meal. 30 minutes later, you use gastric fort. Then 30 minutes later, you can eat. And it's 3, 3, 3.
Okay. Someone that is probably engaging in intermittent fasting, so to say, or probably there is a fast ongoing. How can the person also align himself or herself with the use of this credit product? And the person is probably an ulcer patient also. How can the person do this?
As a Muslim, if you are an ulcer patient, you are allowed to live fasting.
Even as a Christian too.
It's
both religion.
Because I'm not inside that. This is where I am. I need to tell you. Yes, as a Muslim, it is never mandatory for you to fast as an ulcer patient.
Okay.
Because the more you fasting, the more it affects your stomach challenge. Then if peradventure you have a challenge like that, and your intermittent fasting is different from other fasting.
Regular religious fasting.
You understand?
Yes.
So you can, as a Muslim, immediately before you eat in the morning, before your prayer, you can use gastric fort and reishi. Okay. 30 minutes interval. Then when you eat, you use your collaborative. By the time you are breaking in the evening, you do the same thing. But if it's as a Christian, which means you are eligible to use it once a day. When you are breaking the evening, it's 24 hours normally. So that is it.
All right. Okay. So you have heard it all from Mr. Kehinde Adeyemi. So I have a question currently, sir.
Yeah.
As we're about to run to the close of today's edition, from Tayo Adeonipekun. She says on our IGB, she says, can an ulcer patient take colon cleanser?
Yes, an ulcer patient can take colon cleanser. You understand? I have used it for them separately, and some cannot take it.
Oh, why? Is there a reason?
It is the body metabolism.
Okay.
When they started taking it and the body reacted to it, tell the person to stop. Or if they are taking 2, they can reduce it to what? 1.
Okay. So is the colon cleanser now coming before the use of all other credit products that you talk about? The
yes, for 10 days. Yes, for 10 days.
So the person will start treatment with colon cleanser.
Exactly.
After then, you now switch to other products that you just mentioned.
Some people have good body metabolism. When they use the colon cleanser as an ulcer patient, they won't feel anything. I told you when you have a peptic ulcer that it has not been infected.
Yes, sir.
You understand? You may not even have any symptoms until you do the test, and then now tell you that you have a peptic ulcer. Do you understand now? So when you use the product and it doesn't affect you, I'm talking about the colon now. The last thing at night is the colon.
Yes, sir.
When you drink the tea and it doesn't feel anything, you can go for the next 10 days.
Okay.
But if you're having the pains, like angina, you understand? Stop it. Then start treatment food.
All right. Okay. If you're just joining us, this is still Talk to KD, and Mr. Kehinde Adeyemi, he has done justice to the topic of today, ulcer. Thank you so much for coming, and thank you so much for tuning in. I'll leave you with the Totocap active for today as we close. It says, protect your stomach, protect your health, eat balanced diet, avoid the use of non-steroidal anti-inflammatory drugs, and also don't ignore persistent symptoms. Remember, an healthy lifestyle is the best shield to keeping ulcer at bay. Let me read the later part that says again, it said, remember that an healthy lifestyle is the best shield to keeping ulcer at bay. All right. So before we draw it to a close, there's another question which I would like to give to our guest for today. It is from Amarachi Azuna on our Facebook page. She said, can an ulcer patient that eats baked food, the other time you're talking about fried foods and co. So now she's saying, what about baked foods?
I've mentioned it earlier on.
Yes, sir.
Is bread not baked?
Yes, bread is baked, oven made. Yes.
You need to run away from them.
So bread,
you are not helping yourself.
And co.
You are not helping yourself.
Oh.
You are not helping yourself.
Oh.
Sausage is a baked food.
Yes.
And I mentioned it earlier on. You understand?
Yes, sir.
Don't take anything related to those ones.
Okay.
Let me go back again.
All right.
If you are,
let's repeat. That's under the lifestyle.
On the
changes.
fruit,
Yes,
run away from cucumber, papaya, citrus food.
Yes.
When I mean citrus, I mean lemons, oranges, what have you.
Yes, sir.
You understand? Then on the food, white rice.
Yes.
Run away from it.
White rice.
I know the thing where they talk about.
Hey. What did that?
White bread.
White rice, white bread.
Yes.
Wait till I go chop again.
Now food now. There are plenty food to eat.
Okay, sir.
You understand? There are plenty food to eat. So white rice, bread, sausage, those kind of a thing they normally bake.
Yes.
Suya, asun, all these processed meat.
Yes.
Run away from.
Okay, let me digress a bit, sir. What about beans? Because there was a time I do remember that some people would say, okay, once you are having ulcer and this, don't take beans. What about that? Beans, pig milk, and co. All those foods, these are our normal day-to-day.
Don't
things.
take those dairy things. The yogurt is okay, bit. Okay. Understand? Yogurt is okay, bit. But dairy is not all of them you can take.
All right.
Now, people, each person as an individual, you are unique.
Yes.
And whatever I can take, prescribe for you,
yes,
you may not be able to take it.
Yes, because of my own body type.
Yes. That's why they normally say a good doctor cannot treat two people in the same way.
Yes. Yes.
Because what you can take as an individual, your own better, what you can take as an individual, my own better metabolism may not be able to take it.
Okay, sir.
You understand now?
Yes, sir.
There are ways we need to maneuver it.
All right.
When the things are like.
All right. Okay, so you have this is another question, sir. Before we close, we're already behind time, but this another question is the 2-in-1 question from Judiaye on our IG account. She says, "What can one use to prevent female hormone? What can someone use to balance a female hormone?" And then the second question is that, what can one use to insulin resistance?
We are leaving
our topic automatically.
Don't worry.
Yes, sir.
I understood her. You understand?
Yes, sir.
This is a big topic on its own. Female
hormonal changes and hormonal balance.
Hormonal imbalance. Yes. So that question, if I wanted to ask, I needed to see the person and keep asking questions. So why are the people having hormone? Some people have it through the fertility challenges. Yes. They will have challenges of hormonal imbalances. Some people will have that particular problem through when they are reaching menopause.
Yes.
So how to treat the two is different.
Okay.
But in our own case, yes, I will refer the person to M&V.
Oh, okay.
M&V and Eve's Comfort, Golden Seeds will handle that.
Okay. That's for the hormonal imbalance.
All right. Understand? Then the other one,
the insulin balance. Yeah, that's insulin to men now.
To men.
Tilted to men.
Insulin balance. The person is diabetic. Is it 1 or 2? So you need to know. Am I communicating?
Yes, yes.
If it is 1, the way of handling is different from the way you handle the 2.
Yes.
You understand now?
Yes.
So for the 2, we have products for heat.
Okay.
We have Diaware, we have Golden Seeds, we have Lycophyte is not available now. We have Lycophyte. Then Cordura jelly is there. The person can use. But if the blood sugar is getting out of hand, we have margarine to suppress it.
All right. Thank you so much for your contribution, and thanks to our guest, Mr. Adeyemi Kehinde, who has done justice to today's topic. On this note, we'll call it a day on today's edition of Talk to Kedi. I believe you have learned a thing or two in our edition of today. And you'll be able to know the types, the causes, the symptoms, and the step-by-step preventive measures to handling this ailment ulcer. A special thanks to our guest, Mr. Kende Adeyemi, who made out time in his busy schedule to ensure that this edition of today was able to be there to dish out salient information that is very, very good so far. So thank you so much, sir. I don't know whether you have one or two things to say as we close for today.
This what I want to let people to know is that health is wealth.
Yes,
we don't have other two places to live inside except this body. Yes, no matter what you can do to make sure that you can live healthy, please do it. Forget about I'm addicted to something. It's only a living body that's addicted to anything. A dead body cannot be addicted to anything than soil. Yes. Take care of your health. So we can celebrate a lot of things on this day together.
Yes, so I take a cue from that. It says, remember, like I said earlier, remember a healthy lifestyle is the best shield to keeping ulcer at bay. Health is wealth. On this note, we call it a day on today's edition of your #1 educative online broadcast. But in case you join this broadcast late, don't worry, don't fret. The full video of this broadcast will be on our Facebook page at Kedi Healthcare Industries, on our Instagram handle at Kedi Healthcare_official. It's going to be on our YouTube page at Kedi Healthcare. Also, it's going to be on our mobile application, Kedi Care app. And watch, learn, and share with your loved ones. Okay? Please ensure to watch and share with your loved ones because everybody needs this information. So, till I come your way next time, please feel free and also be on the show. Thank you. God bless you.